Hi everyone, welcome to my channel. It's Heather Renee. If you are new, thank you for joining. I hope that after viewing this, you like, comment, and subscribe so you can see more content by me where I talk about infertility, IVF, NICU life, and everything else in between about my life. If you are returning, what's up? Thank you for being loyal. Thank you for bearing with me even when I take time to post videos. I promise I'm gonna get back to doing my weekly postings. So make sure you all hit that notification bell so you know that when I do post, you can see it immediately. I will be discussing the step-by-step process of IVF transfer, and that is with fresh and frozen transfer. If you don't know what I'm talking about, just stick around and you will see. Okay, let's begin. When you are thinking of pursuing IVF, typically you've already spoken with your OBGYN and you've probably already taken some blood tests or whatever, course of action that you've taken, you've done it and you've been referred to a specialist. Only specialists can do IVF. If you're in an office somewhere and they're not a fertility clinic, if they don't specialize in fertility, run, get out of there. It's not where you need to be. Don't do the great value version of IVF, y'all. It's not worth it, okay? Just, even if it costs less, it's not worth it. Just do it the right way. Anyway, when you first go into the infertility clinic, you have an initial consultation. In that consultation, they typically discuss what tests you've already taken and they discuss what form of IVF or treatment would be best for you. And like I said, particularly I'm talking about IVF right now. If you want to know about other treatments that you can do for fertility or infertility issues, please refer back to an older video where I'm talking about different types of treatment. Full disclosure, everyone, I almost forgot. You will hear my 1.5-year-old son in the background. He's okay. I have some cartoons on in the back, but he might run up here occasionally and try to talk to you all too, because that's what he does. Okay, back to what I was saying. You'll go to your initial consultation. The doctor will review whatever blood work you have, or they'll send you to do blood work and then they'll review that with you to determine which form of IVF will be best for you, whether fresh or frozen transfer. Depending on what type of disorder you have and what blood work results say, that is how they will determine your goal and the course that you're going to take during this journey. But they'll go through the treatment process with you, with whichever course of treatment that they decide will be best for you. Also, during this initial consultation, they talk about the potential benefits and the potential risk of the procedure as well. After that initial consult, you have a physical examination, which consists of course, getting ultrasound, checking out your uterus, checking out all that they can see with their machines to see if there's any obstructions. They also check your fallopian tubes to make sure there's not any blockage. They check for anything in your reproductive area that can affect fertility. So you had your consultation, you've had your blood work, you've decided which form of treatment that you want to take, and they let you know whether or not that's something that could work for you depending on what disorder or what physical hindrances you might have. And that's when you get to ask questions if you have any concerns or anything else that they might not have been clear on. Here's the time that you ask those questions. What you should be asking is how it's going to affect you emotionally. I would suggest that you get a therapist during this time. Actually, prior to you starting this process, I would strongly suggest getting to therapy, because the hormonal jumps are going to be there. And of course, like I said before, you want to know if there's a possibility of any potential complications, which that's something I'm going to go into detail about in another video as well, because IVF does come with its risks. Not saying that when you do IVF, you automatically will be susceptible to those risks, but it's something that needs to be discussed. It's something that needs to be known. Next, you're going to go to where you start your personalized treatment plan. And just so you know, a really good clinic will offer really good educational resources so that anything that you discuss, because there are a lot of big words that will be used, there are a lot of medicines that you could possibly be taking, they give you documents and educational resources on all of that. That includes showing what area or spots you take your shots in, potential side effects, what to do if you miss a vial, because that happens, emergency contact numbers, jet. Okay, so the first thing that you start in the IVF process is ovarian stimulation. It's where you undergo hormone therapy to stimulate the development of follicles in your ovaries, and this involves daily injections of the FSH, or follicle stimulating hormone. Now, these medicines assist with creating multiple follicles in the ovaries. Follicles are the little baskets that hold the eggs until it's time for them to release after they've matured. Now, during ovarian stimulation, it's closely monitored with blood work, and they do ultrasounds, not the vaginal ones because you don't want to disturb anything down there. But they usually, do the ultrasounds that they put on your belly, and they're counting follicles, they're counting how they grow. And when they measure how they're growing in those ultrasounds, it's usually going to determine a roundabout number of the possibility of eggs that you can have, because just because you form a follicle doesn't necessarily mean that there will be an egg in there. Now, most clinics will require that you also take some form of birth control, usually the pill, during this ovarian stimulation time, because you want to delay ovulation. You don't want your eggs maturing and releasing at different rates. You want to know the exact time, the exact date, so that you can schedule your transfer appropriately. It depends on the disorder you have and the protocol of the particular clinic, but if they don't prescribe birth control to you and you're curious to see why or why not, just ask. Now, there are several kinds of shots that you can take during the IVF process. It's not always the same for everybody. As I stated before, it's depending on your disorder, if you have one, and whatever plan your doctor is choosing to take with you regarding your infertility. Now, one of the possible shots that you can take is a Lupron injection. And Lupron is basically something that can help support egg quality. It's not 100% guaranteed when you use this shot, but when it came to the opportunity for me to use this shot or not use this shot, I decided why not. I didn't have anything to lose at this point, so I did opt in to use Lupron. The next possible shot that you can take is a GnRH hormone shot, and that stands for gonadotropin release hormone. I will spell it down below. And it can either be antagonist or antagonist shot, depending on what procedure plan your provider wants to go with. Both of those help prevent premature ovulation, because when you're doing this process, you're already trying to build those follicles to grow, for eggs to be in there, grow and mature, and you don't want a bunch of eggs just releasing at different times. You want it to be timed at the perfect timing so that your provider can know when to go in and retrieve those eggs. Next possible injection is the follicle stimulating hormone, or the FSH hormone. This particular hormone encourages multiple production of follicles, and follicles are what produce eggs. Not all follicles will produce eggs, but you want to try to create as many as possible. The next possible shot is the trigger shot, or the HCG trigger shot. I will spell below what HCG stands for. It's already a tongue tie for me with my list, but I will spell it below so that you can Google on your own. But yes, the trigger shot, it helps release those mature eggs that have been forming in the follicles, if any formed in those follicles. And that's typically planned out. And they usually tell you when to take that shot, and then about 36 hours later, whatever mature eggs release are collected around that time. It's very time specific when you take your trigger shot, so make sure you listen to your doctor. Another possible shot that you're taking during this process is PIO, or progesterone in oil. Progesterone in oil. Those of you who have been doing IVF, who have done it in the past or have had friends who've done it in the past, you know that PIO is something else. Not to scare you guys, but it's not comfortable. And depending on how long you've been doing IVF or infertility treatments, you can run out of space on your hymen. But it's worth it because it helps promote thickened uterine lining to help try to keep that embryo baby sticking on that uterus, what we call a sticky baby. But yeah, that's one of the other possible shots that you can take. So now that you've finished ovarian stimulation and you've been monitored by your provider, the next step is egg retrieval. Now, egg retrieval doesn't necessarily mean that you have to be under anesthesia. You really could do it with conscious anesthesia. It's uncomfortable. It is uncomfortable. They retrieve the eggs and you're gonna feel it afterwards. Okay, so after egg retrieval and you've gone home and you're waiting, the waiting phase is what we call the fertilization period and the embryo culture period. Now, in the fertilization portion of the process, once they take that egg straight after retrieval, you have the sperm that your partner released earlier in that day and that's already been washed and cleaned and separated, or if you are a couple or individual that has a donor, that sperm is already washed and separated and prepared, ready to be injected into the egg so that it can be fertilized. Then you wait about 3 to 5 days. You watch it, it's in a little petri dish. I say you, but I mean a medical professional. A medical professional is watching to see if it becomes an embryo culture. Now, once it becomes an embryo culture, you can do further testing for genetic reasons or just to see the sex or things like that, but you can opt out of that. Most people, if you've already made it to the stage and you can afford it because it is an additional cost, they go ahead and do it because they're like, why not? I've already come this far, let's do it. But don't feel bad if you can't afford it and you don't do it. There are many people that go on without getting their eggs tested and have successful pregnancies. So it becomes an embryo. The next stage is to decide a fresh embryo transfer or a frozen embryo transfer. Now, that frozen embryo transfer, it'll be put on ice or put in the freezer until your body heals. Let's say you've done multiple fertility treatments leading up to this, then you need time, then you need time to heal before you move forward with anything. Some people opt to do fresh embryo transfer, which is after those 3 to 5 days when it's become a culture and it's become an embryo. Then they're in there on that 5th day or whatever day they're assigned within that 3 to 5 day period, and they put that egg back in there to go on to the luteal phase to wait and see if it implants and becomes a baby. Now, after you do your embryo transfer, it's up to your provider on whether or not they want you to take progesterone and oil shots, the ones that I was mentioning before. And like I said, it promotes a healthy uterus and it helps what we call sticky baby in hopes that the embryo will stick better to the uterine lining. Now, the waiting phase after the transfer is called the luteal phase support, and basically that's the 12 to 14 day period that you're waiting to see if the transfer was successful or not. I would advise anyone going through this process, please don't test before 12 days. You see, they measure the HCG hormone when you're taking pregnancy tests, and if there's not enough HCG in the urine yet, and if you're not taking it at the right time of day and things like that, then you could possibly get a false negative. I would highly suggest to wait until that 12th day. For future reference, you can't get a fake positive test, but you can get a fake negative. Once you get a positive or negative test, in between that 12 to 14 day range, you undergo a little bit more monitoring from your fertility clinic, and if you're pregnant, you're released to your OBGYN at around 8 to 10 weeks. And if it wasn't successful, then you stay at your fertility clinic and they do further treatment and possibly further diagnostic tests to see what could have went wrong. But I do want you all to understand that just because IVF doesn't work for someone doesn't mean that there's something particularly wrong that you may have done. It could just be your body spontaneously chose not to become pregnant, and there's nothing wrong with you at all. It is so hard already going through these treatments when you're dealing with infertility and you're already blaming yourself because you're like, this is my fault in the first place type of thing. Don't beat yourself up, don't blame yourself. We have no control over what our bodies are gonna do to an extent. except for, you know, lifestyle changes as far as what we eat and put in our body, things like that. But otherwise, we have no control over that. So don't beat yourself up over it. If you need to talk to anyone, I'll leave my email in the description below. I love to talk with people and be there for people because I know how I wish that someone would have been there for me at the time. On average, a typical IVF cycle takes about 4 to 6 weeks. Some people think that it's supposed to be faster than that, but just know it can take about 4 to 6, sometimes longer, like I said, if you're already doing other infertility treatments before that. And the success rates can vary depending on different factors like age and disorder type, but it's anywhere between 30 and 50% success rate for women under the age of 35. But any woman over the age of 35, that percentage gets lower and lower, unfortunately. That's not to say that people over 35 can't have successful and high percentage rates with IVF. That's just the statistics, and I just wanted to state it. But that's all I have for you all today. It's the step-by-step process of the IVF, frozen or fresh transfer. To recap those steps, it's the initial consultation, the physical examination and medical history with your provider, possible diagnostic test if you haven't done that already with your OB that could possibly be transferred to your clinic, discussion of a treatment plan, whether you're gonna do frozen or fresh, ovarian stimulation, egg retrieval. I thought my nail was broken on this nail. One of these nails is broken. Fertilization period, and also the embryo culture phase, embryo transfer, and then the luteal phase of support where you're waiting to see whether or not you get a positive pregnancy test. Thank you for watching. I hope that you hit the notification bell so that you can see when I post further videos, whether it's this topic or other topics that I plan on speaking on in the future. Yeah, but may sticky eggs forever be in your favor. And until next time, bye everyone.